Good afternoon, everybody. My name is Dr. Mannan Gupta, and I am a gynecologist and an infertility specialist working at a Delhi IVF and infertility clinic in Delhi as an IVF consultant. I would like to thank Bayer for this wonderful opportunity to get me on board with this Facebook Live session and answer queries of infertility to the general public. Um, to just make it clear, we are not endorsing any brand here or not promoting any drug in particular, and just supporting the I Am Fine initiative by Bayer for Women. I would like to thank the company for giving me this opportunity. The topic given to me today was infertility. Through all platforms, I've been getting queries related to infertility, and today I would like to address a lot of queries for everybody. So, what is infertility? When does a couple need to be worried about getting treatment and seeing a doctor? So, any couple who is trying to conceive, having a regular intercourse, or getting artificial insemination done for 1 year after getting married and not conceiving, they need to go to a doctor and get themselves evaluated. So, I'll repeat that again. Any couple who've been trying to get a baby for 1 year without success needs to go see a doctor. Now, why is infertility so common these days? So, infertility requires a healthy egg, a healthy reproductive system, and a healthy sperm. Any of these three things, if they're not in the right shape, then infertility will happen. And the health of all these things is governed by the food we eat, the environment we work in, the technology we use, and intoxicants like alcohol and smoking. And so the most of the patients we see do not have good egg quality, and the sperm count is low. So all this is a problem in today's date. So, starting with the causes of infertility, the causes can be divided in between male, female, and unexplained. So, the causes which are more common in female infertility include polycystic ovarian disease, endometriotic cysts, poor ovarian reserve, and bad egg quality. Now, taking these one by one, as age increases of any woman, um, the quality of eggs and the number of eggs decreases. Now, the reproductive age typically of a woman, as given in our books, as seen in our practice, is from 20 to 45. But as we see, everybody is getting married late. They get married at the age of 30 and plan their first child at the age of 32. So their ovarian reserve is almost exhausted. So in such a case, a woman has the option of freezing their eggs now. In today's date, egg freezing is also a very viable option. So what I suggest is that early marriage should take place, and the ovarian reserve should be well utilized by the woman. So coming to how can we measure the ovarian reserve? The ovarian reserve can be measured by a blood test which is called anti-Mullerian hormone or AMH, and a regular pelvic ultrasound. So in an ultrasound we can see how the eggs are and how the egg quality is. So I suggest that the women should get married ideally by the age of 25 to 28 and plan their first child before the age of 30 if they don't want to undergo the process of treatment of infertility. And the most common causes of male infertility includes a decreased sperm count or decreased semen quality. The most common reason for that is excessive smoking or alcohol. So, in today's date, excessive medication, smoking, and alcohol is very, very common among men. And that leads to a poor sperm count, and in turn leads to that can be analyzed by a semen analysis test. And so I suggest, even men to be very careful with their habits of smoking and alcohol. So coming to age, so we have decided that, uh, the ideal age to have a child is before 30 for both men and women. Okay, so causes of infertility can also include a lot of anatomical causes. Sometimes a woman's body's uterus is not healthy enough to hold a pregnancy. So the causes can include diseases such as tuberculosis, such as adenomyosis, fibroid of the uterus, polyp of the uterus, or the tubes are blocked. Now, the tubes can also be blocked due to infections like tuberculosis or any other sexually transmitted diseases. Sometimes even the cervix is blocked. So, for conception to happen, the sperms go through the cervix into the tube where fertilization takes place. But if the cervix is blocked or the tubes are blocked, then that won't happen. So, to check that, a pelvic ultrasound timely is needed. In today's date, stress is a very important factor in all our lives. We are all living in metropolitan cities and very, very stressed about everything that is happening around us. So, stress leads to release of certain hormones, and those hormones in turn affect your fertility capacity. So, they can lead to decreased sperm count and decreased ovum quality, which in turn can also lead to a lot of miscarriages. And so, having a stress free life is better for the reproductive system and to have children. Okay, so coming to patients who are already having a problem in fertility and what to do next. So, the best approach to treating infertility is first finding out the cause of infertility. Now, the cause of infertility will include investigations for both the female and the male partner. The female partner will have to undergo a pelvic ultrasound and certain blood tests such as thyroid, AMH, and prolactin. AMH is anti-Mullerian hormone. Anti-Mullerian hormone, as I mentioned earlier, is more about the ovarian reserve. If a patient is hypothyroid, that is the thyroid hormone is in excess in the body of the female. That can also lead to a hormonal imbalance and in turn lead to infertility. Prolactin is a hormone which governs milk production after the baby is born. So it is also part of the reproductive system and it is analyzed as a baseline and corrected before we commence treatment. Coming to the ultrasound, we see basic number of follicles that are there in the ovaries and basic structure of the uterus, tubes, ovaries, vagina, and the cervix for reproduction to take place. So basic pelvic ultrasound and certain blood tests should be sufficient for basic evaluation of infertility. Coming to the male partner, a basic semen analysis after abstinence for 3 days, ensuring that the sperm count, motility, morphology, everything is within normal range, is also sufficient. So once we have these investigations with us, we have successfully established the cause of infertility, ranging from PCOD or decreased ovum quality or decreased sperm count or an anatomical problem like diseased uterus or cervical stenosis. Most common causes include PCOD, endometriosis, azoospermia, oligospermia, and even Asherman syndrome. Coming to the treatment options that are available to us, now for young patients whose both tubes are patent, whose cycles are normal, IUI is an option. IUI is basically intrauterine insemination, where a sperm sample is taken, washed in the lab. The healthy sperms are differentiated and kept in a catheter, taken, and insemination is done in the uterus. Before insemination, ovarian stimulation is done. This stimulation takes place by continuously giving ovulation induction drugs to the female along with follicular monitoring for about 15 days. But the success rate of IUI is very less. It is only about 10 to 12% per cycle. So if you do 6 cycles, the success rate is about 25 to 30%. So only if we are very, very optimistic about the results of IUI, we should go in for an IUI. The other option, which is a better option, is in vitro fertilization. Now, coming to what is in vitro fertilization. In vitro, the term means doing it in the lab. So in vitro fertilization means that a semen sample is taken from the husband and a healthy egg is taken from the female. Now, how is a healthy egg taken? Usually starting from day 2 of the cycle, ovarian stimulation is done using drugs. Now, these drugs are given in the form of injections to the female every day for 15 days. Once eggs are developed, which is seen through follicular monitoring, eggs are taken from the female by ovum pickup, which is a minor surgical procedure, and sperms are taken from the man by a semen sample. Both undergo fertilization in the embryology lab. Once fertilization takes place, then healthy embryos are chosen after 3 to 5 days, depending on the quality of embryos. And those embryos are transferred back into the female on day 3 or day 5 after ovum pickup. So after embryos are transferred, the patient is kept on progesterone support, and after 15 days of embryo transfer, a pregnancy test is done. So this is the process of IVF in short. And the success rate of IVF depends on a lot of factors, depends on the quality of the endometrium or quality of the uterus, and also depends on the quality of the embryo. Now both these things are two separate entities. Sometimes due to a diseased uterus or due to previous history of tuberculosis, the implantation does not take place. That's why the success rate of IVF is only about 50 to 60%. So to improve that, continuous monitoring of the endometrium is done throughout the cycle of the patient. Now, if the endometrium is not developing, we give a lot of drugs like estrogen to for the development of the endometrium, and the dose of the estrogen is adjusted according to the kind of lining that is seen in the endometrium. Apart from that, if we are doing ovarian stimulation, again, dose of drugs is adjusted according to the kind of response the patient is giving us. The dose can be increased or decreased. Now, coming to a very controversial topic, which is donor egg. Now, as the ovarian reserve of the patient keeps exhausting with age, um, a viable option is to take eggs from a younger female with a more healthy ovarian reserve. So this process is known as donor egg. In this process, we match the physical and the psychological and the background traits of the patient with the donor, and along with that, we use those eggs in the patient, and the patient carries the pregnancy for 9 months. And this is a very viable option, and people even in the higher age group can get pregnant with this process. um, Coming to the psychological effect of infertility, see, infertility is not an easy problem to deal with. After getting married in a country like India, the first thing that is expected out of a couple is to have a child, and if that does not go successfully, the patient undergoes a very bad time, emotional trauma and pressure from the society and from the in-laws. So you should never give up, and keep trying IVF, because in today's date, anybody who wants to get pregnant can get pregnant. We have so many options available with us that getting pregnant is not difficult at all. And a healthy donor egg and a healthy sperm can give you a viable pregnancy. There is no problem. So I would like to take up a question. Miss Richa Jha has asked, besides medical treatment, what option do we have? So I would like to answer that question that, adoption in India is not a very viable option. Anybody who goes to on that route faces a lot of difficulty, and anybody who is facing infertility, whether young or older in age, can go in for IVF treatment, and can also go in for surrogacy if the age group is very high. Surrogacy is a process in which another woman carries your baby, biologically your baby, for 9 months, and is it paid in monetary terms for it. Many of you might be thinking whether it is legal or illegal in India as of now. So as of now, surrogacy, commercial surrogacy for foreign couples is banned in India, but a person who is Indian can get surrogacy done legally, and it is done in the presence of a lawyer. A contract is made where the biological parents have the right to the child, and the surrogate mother is paid in monetary terms for the services of carrying the pregnancy for 9 months. It is a viable option. So IVF and surrogacy being available, I don't think anybody needs to go in for adoption in today's date. They can have their own child. So Mr. Shrikant Reddy is asking me, can endometriosis lead to infertility, and if treated, what is the success percentage of IVF. So see, endometriosis is a very complex problem. Not only does it decrease the quality of the eggs that are present in the woman, it also leads to a lot of problems, starting from implantation, starting to a frozen pelvis, depending on the grade of endometriosis. If it is early endometriosis, only having dyspareunia, that is pain during menstruation and pain during having relations with the husband, then the patient won't have infertility. But if it is advanced endometriosis, say stage 3 or stage 4, that the endometriotic patches have reached the tubes or the ovaries, and the patient is in really very severe pain, then first a diagnostic laparoscopy, hysteroscopy needs to be done. Then we have a very clear picture of what is the stage of endometriosis, and extensive adhesiolysis of the endometriotic cyst and the fibrosis that has gone around the tubes should be undertaken. If there is a big cyst in the ovary, then that cystectomy should be done. If and the patient should be put on strong painkillers before undertaking IVF. Once we have treated endometriosis to however extent we have, then we can go in for ovulation induction, create healthy eggs for the patient, and then give them a pregnancy. The success rate of IVF after endometriosis is very good. It is about 50 to 60%. We can say in 3 cycles of IVF, the success rate is about 90%. If the quality of eggs in the endometrium in a patient of endometriosis due to advanced age is not good, we can always go in for a donor egg. So anybody who has endometriosis does not need to worry about getting pregnant. They have this very viable option of getting IVF done. But treatment of endometriosis also includes getting pregnant. So I would say anybody who has grade 3 to grade 4 endometriosis should plan pregnancy as soon as possible, because pregnancy can lead to a hormonal balance, which will in turn lead to stabilization of the hormonal milieu, and that will make the pregnancy easier. So that should answer your question, Mr. Reddy. Now coming to PCOD, which is a very common problem. So polycystic ovarian disease. What is polycystic ovarian disease? Polycystic ovarian disease basically means that there are cysts which are formed in the ovaries. Now these cysts lead to irregular cycles. A patient who is bleeding every month will bleed only once in 3 to 4 months, and in severe cases they will not bleed for even 6 months, along with excessive weight gain and excessive hair growth. Now this leads to poor ovarian quality, poor egg quality. That is why, since the egg is released only once in 3 months, the patient is not able to get pregnant. So the treatment of a patient who has polycystic ovarian disease along with infertility includes ovarian induction along with IVF. But the complication in cases of PCOD can also be that those eggs will lead to early miscarriages and failure of IVF. So the treatment of PCOD starts from conservative management that includes weight loss and regular exercise. That takes care of a lot of hormonal milieu that is there in cases of polycystic ovarian disease. Carrying on, we can always give them control their cycles by giving them progesterones and a combination of progesterone estrogen pills, and control their cycles. But nobody who has PCOD should be worried about not getting pregnant. Anybody who has PCOD, even in severe forms, can always get treatment and get adequate help from their gynecologists and infertility specialists. So, coming to other causes, say azoospermia or oligospermia. A lot of patients, a lot of males in India have recently been having problems of a low sperm count. Now, patient who has low sperm count in their semen sample, the problem can be at the level of the testes or the level of the vas deferens. Sometimes blocked vas deferens can also lead to a poor semen sample. So the option that these patients have is called TISA, testicular epididymal sperm aspiration. We can always do a small surgical procedure and retrieve very healthy, viable sperms from the testes. So there is absolutely very, very good hope for patients who even have low sperm count. So anybody hesitating, to go to a doctor because they have a low sperm count, thinking of whether this can be treated or not treated, or whether they can have a child or not have a child, can definitely have a child. All we need to do is see whether it is viable to do a testicular sample and treat it according to the problem. So, uh, and the common cause of low sperm count in today's date is smoking and alcohol, as I mentioned earlier. So, coming to embryology, embryology plays a very, very important role in IVF. Now, what is embryology? Embryology is basically when we have a fertilized egg, it turns into an embryo. Now, the work of choosing the right embryo to be implanted back in the patient, having good culture conditions for the embryo to grow and not getting infection, using the right choice of media, monitoring the embryos at the right stage, and choosing the most healthy embryo to transfer it back into the patient, is the job of an embryologist. Now, the job of an embryologist also includes to maintain a very, very healthy and a very, very clean embryology lab, which is utmost important in giving a healthy result to the patient. So, embryology is the most essential part of any IVF setup. So, all my gynecologist colleagues out there, if they want to get into infertility or get into IVF practice, they must concentrate on learning embryology first. Coming to also diagnostic laparoscopy and hysteroscopy. See, a woman's body at the end of the day has to carry a pregnancy, and no other investigation rather than actually putting a scope inside the body and having a first-hand look at the uterus and the ovaries will give us the best picture of the pathology that is leading to infertility. So anybody who has multiple IVF failures, or who has a disease of a past history of multiple abortions, or who has been trying to conceive for a long period of time, must undergo a diagnostic laparoscopy or hysteroscopy. Once you have a hysteroscopy picture, and if you have a healthy endometrium sample which is analyzed by a good pathologist, then treating that problem is not difficult at all, and one should never hesitate to undergo a hysteroscopy. I've seen a lot of practitioners just blindly giving ovulation induction to patients and hoping for them to get a pregnancy without any result. But first, let us evaluate what the problem is, and that evaluation can be done by doing hysteroscopy and laparoscopy, and it is such a small, short, easy, effective procedure which will lead to very, very efficient results. So, I really strongly recommend a diagnostic lapro histro and a good blood work before any treatment is commenced. These days, IVF has become a very, very commercial process. Gynecologists all over the country have been given targets by corporate hospitals of the number of cycles they are supposed to do in a month's time. But a good practitioner will always go into the detail of the pathology that the patient has, and then treat that problem accordingly. So it is very, very important that we have a holistic approach towards the patients, and not just commercially try to just have extract money out of the patient. The day we think that we just want to extract money out of the patient, we'll not become a good doctor, and we'll just lose the trust of people around us. So a good practitioner should maintain honesty and be ethically very, very sound, so as to have a strong sense of devotion towards their job. So I think I have briefly covered infertility management, and I hope I have answered questions of all my viewers and of all the people who have questions regarding infertility. I will be very happy to help and to answer these if at all anybody has more questions to ask. Um, okay, so there are some more people who have questions. So Mrs. Nisha Sharma is asking me, sir, please explain how weight gain affects infertility. So obesity leads to the release of a lot of hormones, And these hormones in turn affect the egg quality, and this in turn, like weight gain, will can also lead to polycystic ovarian disease. As I mentioned earlier, weight gain, polycystic ovarian disease, and the quality of eggs, they are all related. So anybody who's looking to get pregnant and their BMI is more than 24, or they are overweight, the first and the foremost thing that they should do is decrease their weight, because a patient in the higher weight category will never have a good egg quality, and their propensity or the likelihood of them leading to polycystic ovarian disease is very high. And polycystic ovarian disease will in turn lead to infertility. So obesity leads to PCOD, leads to infertility. And obesity per se releases hormones which decreases the egg quality. So, weight gain is directly proportional to infertility. The more your weight is, lesser are the chances of you to get pregnant. And the first line treatment of polycystic ovarian disease is also weight loss and exercise, because that in turn creates a very healthy endometrium and creates a very, very healthy blood flow to the ovaries. And this will in turn improve your egg quality and the quality of the endometrium. So I hope, Nisha, I have answered your question of how weight gain affects fertility. So, try and control your diet and try to regularly exercise. This will give you a healthy endometrium and a healthy egg. That these are the only two things you need for getting pregnant. So Mr. Rakesh Sharma is asking me, will IVF significantly increase chances of having twins or triplets? Okay, so you're right. In IVF, the chances of having twins and triplets is very, very high. Reason being that after ovulation induction, we get multiple eggs from any patient, and multiple embryos are made in the lab. So all these multiple embryos are then transferred back into the patient, and sometimes multiple implantations take place. That can be 2 or 3 in number. These multiple embryos are transferred back to the patient in a hope that at least one will get implanted and the patient will get pregnant. If a patient is undergoing IVF, it is a very, very emotional process for the patient as well as the doctor, because they have been suffering from infertility mentally, physically, and then you are giving them hope. And so we try our best and transfer multiple embryos at the same time. But latest literature and international journals have been recommending single embryo transfer recently. They say that choose the most healthy embryo, do a prenatal genetic diagnosis, take an embryo biopsy, run it through the labs, and see whether that is a healthy embryo or not. And once you have a healthy embryo, transfer the most healthiest embryo and transfer only one embryo. That is the latest school of thought and the latest literature that is available around the world. But in India, since prenatal genetic diagnosis is illegal, and hardly any patients are, hardly any centers are doing it, so we still are believing in transferring 3 to 4 embryos and freezing 2 to 3 embryos for the next cycle. So that is why the chances of having twins and triplets is high. However, if there are triplets, we always have the option of reducing one of them later at a later stage, and the patient can only have 2 babies, that is twins. So nobody needs to worry in case they're thinking of getting IVF done, whether they will have triplets or not. Because in case they have triplets, there is always an option of medical termination of pregnancy of one of the fetuses out of 3 and giving them a healthy, viable twin. Mrs. Savita Bansal, age 23, unmarried, FSH 1.88 and LH 0.95 periods. So, Mrs. Savita, I would like to tell you that, you are a typical case of polycystic ovarian disease, that you don't get periods without medication and without withdrawal. So there is nothing to worry. We can always do IVF for you and give you pregnancy and a healthy child later on. You don't need to worry. Polycystic ovarian disease in India is very common. 1 in 4 females of reproductive age group have polycystic ovarian disease. So there is nothing to worry about. If you have to take medication to get your periods, there is only a hormonal problem. It is polycystic ovarian disease. It is 100% treatable. There are many options which are available for you to get pregnant. So you don't need to worry. Nisha Sharma is asking, doctor always treat PCOD with metformin. If in case metformin tablet is intolerable, then what is the second treatment? So polycystic ovarian disease has a wide range of treatment. It starts from conservative management, which includes weight loss and physical exercise. Then we have medical treatment, which includes drugs like metformin and oral contraceptive pills, which are very very good these days. So my drug of choice for polycystic ovarian disease has always been diane 35. I think it is cyproterone acetate, and it is one of the most effective drugs that are around. But me being an infertility specialist, we cannot give contraceptives for polycystic ovarian disease management. So we always go in for ovulation induction along with IVF. And if you are not able to tolerate metformin, I would suggest that you can always change the formulation of metformin. What I mean to say is change the brand name or change the brand. Try to reduce your weight, and also going for a contraceptive pill if you're not planning to get pregnant. And if metformin is giving you good results, and if you are having gastritis along with that, which metformin results in, you can always take a Pandy or a Pantop along with it, and not eat it empty stomach. You should always eat it with food. So that should help you, Nisha. Okay, Mr. Pankaj is asking me, are there any restrictions while undergoing IVF? So there are no restrictions in IVF legally as of now in India. Legally we are completely safe, and the law permits IVF and IVF with egg donation. But yes, in egg donation, donor anonymity has to be maintained, and the identity of the donor cannot be revealed to the patient. That is something that we have to take care of. And there are no legal implications. Nothing is illegal in IVF. There are not many medical legal implications that many gynecologists are worried about. That we'll get into IVF and then we'll have to go to court. But nothing like that. It's completely legal. Yes, it is an expensive process because the hormones and the injection used for ovulation induction are on the expensive side. So we need to be very, we have to look at our pockets when anybody is getting IVF treatment done. It is not affordable to everybody, but with advancements in the kind of drugs that are available to us, we are reaching and trying to make IVF as affordable as possible for everybody. And I hope I've answered a lot of questions that were asked to me, and I would like to thank Bear for Women. It has been a wonderful session. I'm really grateful to everybody who has given me this opportunity to come here today and talk about infertility and treatment options for infertility. And in future also, if anybody would like to have any questions that I need to answer, they are free to approach me. Thank you very much.